Thanks.
Okay, last speaker on this session is Lukan from Bulgaria, and you will tell us or show us a video on digital filtering and visualization, your way of visualization of the pictures.
Thank you for the opportunity to show this. Actually, these are few modes of enhancement. This is intraoperative fluorescein angiography done with digital barrier filter, which is interesting. This is a case of branch retinal arterial occlusion. You can clearly see the area of affection, and of course, you can do intraoperative FFA guided endo laser to just treat the areas which are affected with ischemia. So this imaging modality might be quite useful in any vascular diseases intraoperatively. This is just to show the image quality in a submacular hemorrhage case with advanced age-related macular degeneration. Again, you can see the leakage, and it might justify anti-VEGF in the end of the surgery or whatever you want. Here it's interesting because this is diabetic case, and you see that the vessels are non-perfused. This is a venous flow. You can see the embolus there. So the venous congestion is interesting phenomenon because during the indentation there is a reperfusion of this particular vein. So these are phenomena which actually occur in the eye, but we don't see them without vascular imaging. Again, intraoperative guided endo laser, which might prove more targeted and hopefully more effective in terms of preserving the quality of life and vision of the patient. So you can see the reperfused vessels here. This is an example of one of my two filters. This is enhancement of obviously the blue color. And what is important for the digital filters is actually the reflectance of the tissues underneath. So here you will see a second filter because this fundus is a bit pale, and you see that somehow the image on the right side is with more details. So there is no filter which fits all situations. We need to play a lot in order to achieve the best image possible for us in that situation. And here, this is an intraoperative fluoroscopic visualization of the vitreous, again achieved with barrier filter and excitation light, and everything is digital. So for the first time, we are able to see not only the surface of the vitreous, but the vitreous is stained inside. So we can see all the phenomena which were described as a sphere of influence or field effect of how the vitreotom actually removes the vitreous and how the vitreous behaves in front of the vitreotom. So I think if we see better the vitreous, we might do our vitrectomy better. Thank you.
Thank you, Luca. Thank you very much for these great images. We're completely running out of time. Two questions, very short answers. The fluorescein angiography intraoperatively, how do you do it?
It takes like 5 minutes, like a regular angiography, but you need to have an excitation light source in order to excite the fluorescein, and you need to have a digital filter recipe, in my case of the Ingenuity, in order to capture the fluorescence.
Okay. Thank you. The very last question to you, Andres. Would this be an unmet need for you? Would this be an unmet need?
Like a real need for this? Can I be honest?
Of course you can.
It depends on Dr. Egg. No, I would say that it's interesting. I think R&D is very important. to find like new features that are really important to be incorporated into our daily basis. But most of us won't even use it because it's time consuming and cost and ineffective, but that's it.
Okay, thank you very much for this closing remarks, and I would like to thank all the panelists and the industry partners for putting together the slides. It was a great session. Thank you very much. To you still sitting here in the room. You don't have to worry. We're going to have one last unmet need and the final discussion we had in between. So after this session, we will go out for dinner.